Hi, I'm Dr. Brad Shook. I'm a board-certified chiropractic physician in Hickory, North Carolina. My clinic is Hickory Spine, and today I want to talk to you about scoliosis and how to check for scoliosis. Okay, so scoliosis is when, if you look at someone from the front, as I'm facing you, it's looking to see if they have a curvature of the spine. See, in this position, your spine should be in a straight line from your pelvis to the base of your skull. Okay, so if we could see, like with an x-ray, we could see that spine should be straight. A scoliosis is where there's a curvature of the spine that, if there's a curvature, you can often see it by looking at a few different anatomical points on someone. Okay, so very commonly what you can do to check for scoliosis is you can look to see are their ears level. So if there's let me see if I can get squared up to the camera here. So if the head's tilted, one ear is going to be higher than the other. Okay, so that would give you an idea that the head's crooked. Well, why might the head be crooked if they're just standing there in a normal position, what they think is straight? Well, it could be because there's a curvature of the spine. Okay, so we're looking at the body to see if there's a curvature of the spine. The next thing is, looking at the eyes, or the eyes level, looking at the shoulders. So do you have one shoulder that's higher than the other? And you can just have, what you can do is you can have your child or whoever you're looking at stand there, close their eyes, just move around, right? Just kind of wiggle around and then come back to what they think is normal and open, and keep their eyes closed. Actually, keep the eyes closed, and then just observe. Is one shoulder higher than the other? Is the head tilted? You can look at gaps between their arm and their body. So when you stand with your arms by your side, you're going to see a small gap between your body and the inside of your arm. So you can look to see, is one of those gaps smaller than the other? If it is, then that can give you an idea that there's a curvature or a rotation or twist. Okay, because scoliosis is not just side to side; it's also a rotation of the spine. So you can look there between the arms. You can look at the shoulder height. You can look at the level. Are their hips level? So you can actually take your hands and put them on their hips and look to see if they're level. You can look at their belt line, right? Look at their waistline and see, is it tilted one way or the other? If it is, that can give you an idea. Now, something else that you can do, which is really difficult to demonstrate on a video, at least with this video. Maybe I can record a separate video showing you this, but you can probably also do a Google search. But it's something called Adams test. Now, when you do Adams test, it's to check for scoliosis. Now, growing up, you may have experienced this in schools because they often do it, and I remember having it done several times. And what you would do is, the person that's checking you would stand behind you, and they would have you drop your chin to your chest and roll down, and they would observe. They would look at you from behind, and they would look to see, as you rolled down, they would look at the top of the back to see if there was any humping, so rib humping. So if they noticed a rib was higher on one side, then they knew that there's probably a twist in the spine, and that's actually, that's one of the best ways that I check for scoliosis. Now, I'll look at someone like I just described to you, and then I'll have them turn around and drop and roll down, and they go all the way down. Okay, they go all the way down, so you can look at the curve of the spine. You might have them do it one or two times, so you can look and see. And that's one of the best ways that I know to check for scoliosis. That's actually how it's done in most medical settings, is they'll have you do that movement. And then if it's obvious when you've been down that there's rib humping, you can often touch with your hand and feel it. And then it may be appropriate to take an x-ray, because scoliosis, if you have a 0 to 20 degree curve, now what we do is, if we take an x-ray, you can measure the scoliosis. 0 to 20 degrees of curvature of the spine is something that can be treated, using non-surgical and very non-invasive and safe therapies. So we might do things like spinal adjustments, or exercise and stretching, or we might do spinal decompression therapy, or things along those lines to help decrease pain and improve your function. Now, if it's 20 to 40 degree curve, and there's more bending and more curvature there, then that's where someone's going to need to have consideration of bracing. So they can put braces that try to support the spine and straighten it and keep it from growing more into a curve. And then if it's above 40 degrees, well, that's where you actually really need to consider and you need to see a spinal surgeon for a consultation to see whether or not it's appropriate that you even consider spinal surgery. Because really, when you start getting into that much of a curvature, you can actually compromise organ function. Now, I want to say this: if you are someone that has a significant, or if you have a child that has a significant scoliosis, reach out to my office. There is a group, and I don't want to misquote the name of the group, or I would tell you right now, there's a group that has created some very advanced bracing systems that are amazing. Amazing. I mean, absolutely amazing. And the last thing that you want to do is, unless you absolutely have to do it, is have Harrington rods, which are the surgical rods that straighten the spine and they screw into every level of the spine, to have those done. I mean, there's an amazing bracing system, and I can't remember the name of it right off the top of my head. I don't want to say the wrong thing because I know there are companies out there that do similar things, and there's only one company that makes they actually custom fit the brace to you, and they do amazing work that I would recommend. So it's the only one that I know that's extremely scientifically based, and I'm not saying the others aren't. This is just the one that I know of that I have great confidence in. So I'll share that with you guys in another video. I'm actually going to make a note to do that now, and you can come back here, and if for some reason you don't see the video of this, it's going to be on our, I'll tell you what, I'm going to put it on our website. It's going to be in our Scolio education series, which is what you're watching now, and it's going to be the Scoliosis Brace Company, okay, that I recommend. And they actually fit you, and they have doctors that are trained to specifically deal with more advanced cases of scoliosis. And I'm going to share that with you. So you can find it there. If you don't find it there, please don't hesitate to give us a call. My staff will help you out. If they don't know, they'll ask me, and I will make sure that you get that information. But if you have a scoliosis, or if you have a problem, don't hesitate to reach out to us. I'll be happy to give you my opinion on your case and see if I can help you. If I can't help you, I'll make sure that you get to the right person. Okay. If you're interested in an appointment, just give us a call. Our phone number is 828-324-0800. You can also learn more about our clinic at hickoryspine.com. If you have any questions, please don't hesitate to let us know. And I hope this has helped you better understand scoliosis, and hope you have a great day. Thanks.